Welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. My name is Dr. Linda Snetzelaar. I am editor-in-chief of the journal. Today, we are discussing diversity and equity in research, and with me is Dr. Carmen Biker-Shanks, who is a PhD registered dietitian nutritionist and also a principal research scientist in the Gretchen Swanson Center for Nutrition. And as well, she is faculty at Montana State University. Dr. Biker-Shanks, thank you so much for being a part of our podcast today.
Thanks for having me. I'm excited to be here.
I want to continue with just a few questions, so I will begin with the first. Why is it important to include equity and diversity when we're doing our research?
Yeah, so diversity and equity and inclusion, all of those issues are coming to the forefront of our profession as well as our society as really important to solve inequities that exist. And so as a public health nutrition scientist and a registered dietitian, I view these issues as paramount to promoting health in our society through our tool, which is nutrition. Um, Diversity really is the differences that exist between individuals and groups. And so within each person and across groups, what they eat and why they eat really differ based on personal and group diversity. So gender and sex, race and ethnicity, cultural background, socioeconomics, geography, education, and a myriad of other factors all drive why individuals choose different foods. And then in terms of equity or equal access to opportunities and resources, um, equity in nutrition is really multifaceted. So not everyone has equal access to opportunities and resources when it comes to accessing food. For example, living in places with access to less healthy food or having a lower income drives some of the inequity or reasons why people may not choose particular foods within our food system. So in terms of applying that to research, research is really designed to develop knowledge and solutions for our society's problems. And one of the issues in nutrition being making sure there are healthy diets across all people. And without understanding diversity and equity, research broadly cannot develop the appropriate knowledge or strategies that will support people to navigate healthy choices within their daily lives. And I'll also add a piece. Your question wasn't specifically about inclusion, but I'll also add a piece about inclusion because I think it's really important that all people and groups are considered within our work so that we can include their myriad of life experiences that people bring when they navigate their own food choices. And so making sure that we're considering diversity, equity, and inclusion.
Thank you, Carmen. You're 100% correct. I think that that concept of inclusion is very important. Thank you for adding that. Your manuscript, The Need to Incorporate Diversity, Equity, and Inclusion, Reflections from a National Initiative Measuring Fruit and Vegetable Intake, discusses the topic of the measurement of fruits and vegetables when we're looking at various intakes. How was diversity, equity, and inclusion focused on in this particular research that you did?
Yeah, so as many listeners are aware, fruits and vegetables greatly improve health, but a more majority of adults in the U.S. Don't consume enough fruits and vegetables. And now, when we think about issues of diversity, equity, and inclusion in the U.S. specifically, groups that identify as racial and ethnic minorities and individuals with low incomes report even lower fruit and vegetable intake than other adults. And so there is a true inequity that exists there. They also have higher rates of food insecurity or the lack of ability to access safe and nutritious food all the time. And so lots of interventions have been implemented in research across public health to reduce fruit and vegetable access barriers for these populations and others. And so alongside these interventions, research is conducted to really assess the influence of an intervention, such as, let's say, an intervention that uses SNAP plus nutrition education to really assess the influence of this intervention on fruit and vegetable intake. So asking, like, does this intervention, is it a good way to increase fruit and vegetable intake across this population? And so when doing that research, measurement of fruit and vegetable intake is conducted. And the focus of this manuscript arose from work that I am doing to evaluate the impact of a national intervention that is funded through the U.S. Department of Agriculture and the Farm Bill and is implemented through the National Institute of Food and Agriculture within the USDA, also known as NIFA. And it's called the Gus Schumacher Nutrition Incentive Program, or referred to shortly as GUSNIP. And when doing the national evaluation for that work through, it's called the NTAE, or the National Training Technical Assistance Evaluation and Information Center, which that center's goal is to aggregate data collected by many programs across the U.S. that are implementing a nutrition incentive or a produce prescription intervention. And one of the main research questions is, do these nutrition incentive or produce prescription programs, which provide additional financial incentives to low-income groups for fruits and vegetables, for low-income groups to purchase fruits and vegetables, does this financial incentive, does it increase intake? And so at the beginning of the process for the NTAE, or the center that I'm working with to evaluate this question, we had to look across fruit and vegetable measurement tools that could be applied broadly across the US. And what that process did was it made our team realize that there are not a lot of fruit and vegetable intake measures that incorporate issues of diversity, equity, and inclusion. And so when developing the tools that we were providing to programs that were implementing nutrition incentives or produce prescriptions to survey their participants, we realized that very few measures exist that are validated and can be applied across populations. And the closest thing that we could find that we felt like really could capture broadly intake across thousands of participants of fruits and vegetables was the Dietary Screener Questionnaire, or what's referred to as the DSQ. Within the DSQs, there's a 10-item fruit and vegetable intake screener that is used by NHANES. And so we started to apply that measure with the programs that are funded to implement GUSNIP. And we quickly got feedback from grantees, participants, and communities that the measure doesn't account for diversity, equity, and inclusion among the various GUSNIP programs, among the participants who participate. So, for example, in the DSQ, many programs asked to expand the food examples that were asked. So within the 10-item screener, there's a question about fruit, and the fruit question has asks about how much fruit a person has consumed within the past 30 days. And it has some example fruits, and like one that's listed as bananas, and some populations that are benefit from nutrition incentives and produce prescriptions, they don't eat bananas, so they eat other things like berries. And so some of the grantees who implement the DSQ on the ground asked, like, oh, can we switch out food examples? Others wanted the survey to be translated. Others wanted the survey to consider multiple gender identities. Others wanted to ensure that food access questions were paired with the screener to capture equity issues and access. And so we had multiple requests during the first year of this work, and we realized that failing to incorporate these broad issues of diversity, equity, and inclusion in our research would lead to bias in the data collected and errors in the data that we report. And we felt as an NTAE a lot of responsibility to ensure that across this national initiative, which our work is responsible for aggregating data from thousands of participants to, ultimately report on the success of this program, that we felt that we have a responsibility to capture the diversity, equity, and inclusion issues that come with fruit and vegetable intake in our measures. And so we began the journey to look at the evidence base, to talk to grantees, participants, and communities, and to begin the process of adjusting our tools in a way that kept the integrity of the tools, but also ensured that participants could adequately answer the questions or explain their life situations to be reflective of their own experiences. And so, making sure that we were accurately able to capture increases and decreases in fruit and vegetable intake felt really essential in the work that we were doing. And the most important part is that when getting results from this work, that we are able to make recommendations for tailoring programs and interventions to the community so that our measures, one, capture fruit and vegetable intake accurately, but two, communities are able to use the results to say, oh, fruit intake is low or vegetable intake is different than we expected in this type of vegetable category. So we're going to tailor the programming or the intervention to make sure that it fits the audiences that we're working with.
Very important ideas that you're bringing across at this point. As a researcher, what can, for example, I do to think about my future research and avoid potential problems, those problems you were just describing?
Yeah, so I think that the first step is to think about the populations that researchers are working with. And so thinking about diversity, equity, and inclusion, all three of those, and how it applies to that population and what they eat and the choices that they are able to make. So that's the first step. The second step, I think, would be looking to the evidence base to see if any other research has been conducted around the populations that a researcher is planning to work with, and using that information to inform the measurement tools that are being used and to tailor programs and interventions to ensure that they land well with the populations, and the populations can understand them that are being worked with. Gathering input from participants and communities along the way is invaluable to ensuring that the way that nutrition intake is being measured and interventions are being delivered is appropriate. And then taking the evidence, the input from individuals and groups, and then tailoring the tools and interventions to meet the needs of diverse audiences, support equity, and being inclusive of all the different types of people that are involved is definitely a step in the process. And I think that one key point I'd like to bring across is that as researchers systematically including issues of diversity, equity, and inclusion in our research will help us to build the evidence base for strategies that are policies or strategies in our food system or strategies in our environment that can be truly tailored to people and groups and truly support their needs for healthy eating. But if we're not considering these issues now and capturing them and publishing on them, then it's hard for other people to learn from, other nutrition researchers to learn from them and apply it into future interventions.
Thank you. Very helpful. Nice to separate those into steps. Thanks so much.
Yeah.
And then finally, how might practicing RDNs use this type of research in a clinical setting?
Nutritionists in the clinical setting, they're collecting data themselves about their patients. And so, and then providing, personalized interventions for people. And so looking to the evidence base to gather information, gathering input from the people that they're working with about suggested dietary approaches, trying to understand someone's background, their culture, the reasons why they choose the foods they choose, the challenges that they encounter in their daily life, will all work to help nutritionists in a clinical setting to tailor the intervention recommendations that they make to diverse audiences, make sure that the recommendations are able to be followed through in the lives that people navigate. And for example, approaching like dietary solutions with certain health conditions really takes knowledge about a person's cultural background to make sure that the recommendations fit. And without these considerations, the nutritionist really risks being misunderstood or misheard, and the individual doesn't leave with the adequate tools to approach navigating nutrition in their daily life. So I think really similarly to a researcher, a nutritionist in a clinical setting has to systematically include issues of diversity, equity, and inclusion in their work in order to help a person to implement strategies in an appropriate way for their own health.
Thank you so much. Very, very helpful to those out there who are in a clinical setting. And I just want to conclude by thanking you so much for sharing this information with us. Research, I think, has the potential to move forward in a very positive direction, given some of this incredibly important work that you have done. And I just want to thank you so much for your leadership.
Yeah, thank you for the opportunity to interview. And I think that there's, great potential to benefit the people that our field works with if we really consider their diverse needs and experiences. And I'm so excited to be a part of this field in the moment that diversity, equity, and inclusion is really being considered.
Thank you so much. We appreciate all the work you're doing in this field. Thank you.